A measles outbreak in central Indiana has health officials urging Hoosiers to get vaccinated. But some people are still saying no. 13 confirmed cases are confined to 2 counties, Boone and Hamilton. RTV6 News reporter Chris Proffitt joins us live in Noblesville tonight to explain why some people are refusing to get vaccinated. Chris?
Erica, that vaccine provides 99% protection against measles. So why tonight are some parents still choosing not to have their children immunized? Doctors say that can be a life-threatening decision. The number of confirmed measles cases stands at 13 and confined to Hamilton and Boone counties. Noblesville schools with 2 cases warned this week that without immunization, children couldn't return to school. On Thursday, nearly 50 students and school employees got the free vaccine, but some are children whose parents fear about the safety of the measles vaccine itself.
It was a personal choice, so we had decided to wait on them, and we didn't feel it was a big risk for the measles, so we didn't do it.
While Noblesville school officials say the number of children not immunized represents a fraction of its 9,400 students, those that aren't come largely from families who object for religious reasons or out of fears that vaccines can cause long-term health problems. Dr. Andrew Rachual understands parents' concerns.
These vaccines are safe. Many of the fears that have come out about autism haven't been true. They haven't shown true in the studies. But I also understand there's a really strong emotional feeling that I want to do what's best for my child.
But measles are here, and health experts say that what's best for children is immunization, since the disease can be life-threatening, from causing pneumonia or even brain infections.
So, who's going to go first?
The state health department traced the cases to an infected couple who recently returned from an overseas trip and then visited the Super Bowl village. A case, say health officials, that illustrates how vulnerable the public is to exposure.
Based on the volume of phone calls we're getting and the reaction that we're seeing, yes, I think people are taking it serious.
Because, say doctors, the best way to interrupt the transmission of measles is to have a population that's protected.
As measles is in this area, and it is very infectious. It has above a 90% infectious rate if you come in contact with it. But that's if you're unvaccinated. With a vaccine, you have close to 99% immunity.
From an age-old disease that doctors say needlessly sickens and even kills. And doctors say tonight that parents need to talk to their child's pediatrician about the safety of these vaccines versus the risks of getting measles. Live in Noblesville, Chris Proffitt, RTV6 News.
And here are the symptoms you need to watch for: coughing, runny nose, a full body rash, and fever. Because most people have been immunized against measles, those who haven't received the vaccine are at highest risk for the contagious virus. If you develop any of these symptoms, contact your doctor. For more information, including a list of possible exposure locations, just head to theindychannel.com and look for the measles story on the homepage.